Skin cancer is a condition characterized by the abnormal growth of cells in the skin. Typically, old skin cells die and are replaced by new ones. However, this process can become disrupted, especially after exposure to ultraviolet (UV) light from the sun, causing cells to proliferate excessively. These cells may either be benign, non-cancerous, and remain localized, or malignant, cancerous, and potentially spread. There are several types of skin cancer, each originating from different skin cells and presenting distinct characteristics. Basal cell carcinoma, BCC. This is the most common type of skin cancer, originating in the basal cells, which are located in the lower part of the epidermis, the outer layer of the skin. BCCs usually appear as small, shiny bumps or nodules and may have a pearly or translucent appearance. They are typically slow-growing and rarely spread to other parts of the body, but if left untreated, they can invade local tissues and cause significant damage. Squamous cell carcinoma, SCC. SCC develops in the squamous cells, which are found in the outer layer of the skin. It often appears as a firm, red nodule or a scaly, crusted lesion. SCCs can be more aggressive than basal cell carcinomas and have the potential to spread to other areas if not treated promptly. They commonly arise in sun-exposed areas such as the face, ears, and hands. Melanoma. This type originates in melanocytes, the cells responsible for producing melanin, the pigment that gives skin its color and helps protect it from UV radiation. Melanoma is the most serious and potentially deadly form of skin cancer because it can spread rapidly to other parts of the body. It often presents as a new or changing mole or as a dark spot with irregular edges and uneven color. In addition to these main types, there are several other less common skin cancers. Kaposi sarcoma. This cancer originates in the cells that line blood vessels and lymphatic vessels. It often appears as purplish or reddish-brown patches or nodules on the skin, and it is associated with immunosuppression, such as in HIV/AIDS. Merkel cell carcinoma. This rare and aggressive skin cancer develops in the Merkel cells, which are involved in the sensation of touch. It typically appears as a painless, firm, and rapidly growing nodule on the skin, usually on sun-exposed areas like the face, neck, or arms. Sebaceous gland carcinoma. This rare cancer arises from the sebaceous glands, which produce oil for the skin. It often presents as a painless, firm nodule or tumor, usually on the eyelids or other areas of the face. Understanding the different types of skin cancer helps in early detection and effective treatment, underscoring the importance of regular skin examinations and prompt medical attention for any suspicious changes in the skin. The most common warning sign of skin cancer is a noticeable change in your skin. For instance, a new mole or a change in an existing mole's size, shape, color, or bleeding could be a sign of skin cancer. Additionally, a pearly or waxy bump on areas like the face, ears, or neck might indicate a problem. A flat, pink or red or brown patch or bump can also be a warning sign. Sometimes areas on the skin may look like scars, which can be a cause for concern. Skin cancer primarily results from excessive exposure to sunlight, especially if accompanied by sunburn and blistering. Ultraviolet (UV) rays from the sun damage the DNA in skin cells, causing abnormal cell growth. These cells can proliferate uncontrollably, leading to cancer. While skin cancer can affect anyone, certain groups are at higher risk. Before age 50, it's more common in women and individuals assigned female at birth, AFAB. But after 50, it tends to be more prevalent in men and those assigned male at birth, AMAB. Additionally, non-Hispanic white individuals are about 30 times more likely to develop skin cancer compared to non-Hispanic black people or those of Asian Pacific Islander descent. Diagnoses in individuals with darker skin tones often occur at later stages, complicating treatment. To diagnose skin cancer, a dermatologist will first inquire about any changes in existing moles, freckles, or new skin growths. They will then examine your entire skin, including less visible areas like your scalp, ears, palms, soles, between toes, and around genital and buttock regions. If skin cancer is suspected, a biopsy will likely be performed. This involves removing a tissue sample for examination under a microscope by a pathologist. The results will determine if the lesion is cancerous, its type, and the best treatment options. Cancer staging indicates how much cancer is present and its spread. Stages range from 0 to IV, with higher numbers reflecting more advanced disease and complexity in treatment. Melanoma staging differs from non-melanoma skin cancers, such as those originating in basal or squamous cells. Melanoma staging, Stage 0. Melanoma is confined to the top layer of the skin. Stage 1. Melanoma is low risk with no evidence of spread and is generally curable with surgery. Stage 2. Features suggest a likelihood of recurrence, though there is no evidence of spread. Stage 3. Melanoma has spread to nearby lymph nodes or skin. Stage 1. Melanoma has spread to distant lymph nodes, skin, or internal organs. Non-melanoma staging, Stage 0. Cancer is localized to the top layer of the skin. Stage 1. Cancer extends into the top and middle layers of the skin. Stage 2. Cancer moves to deeper layers of skin or targets nerves. Stage 3. Cancer has spread to nearby lymph nodes. Stage 4. Cancer has metastasized to other body parts and organs such as the liver, lungs, or brain. The treatment for skin cancer varies based on the stage and type of cancer. In some cases, a biopsy may be sufficient to remove all cancerous tissue if the cancer is small and localized. For more advanced cases, several treatments are available, often used individually or in combination. Cryotherapy involves applying liquid nitrogen to freeze and destroy cancer cells, which then slough off as the skin heals. Excisional surgery entails removing the tumor along with a margin of healthy skin to ensure complete removal of cancer cells. Mohs surgery is a precise technique where only the cancerous tissue is removed while preserving as much healthy tissue as possible, and is typically used for cancers near sensitive areas such as the eyelids or lips. Curettage and electrodesiccation involve scraping away cancer cells with a sharp instrument, followed by destroying any remaining cells with an electric needle. This method is often used for basal cell and squamous cell cancers. Chemotherapy, either topical, applied directly to the skin, or systemic, taken orally or through an IV, is used to kill cancer cells. Immunotherapy works by stimulating the immune system to target and destroy cancer cells. Radiation therapy uses targeted beams of energy to kill cancer cells or prevent their growth, while photodynamic therapy involves applying a medication activated by light to destroy precancerous cells. Each treatment comes with potential side effects. Chemotherapy can cause nausea, vomiting, diarrhea, and hair loss. Other treatments might lead to bleeding, pain, swelling, scarring, nerve damage, skin infections, or tumor regrowth. Preventing skin cancer is largely achievable through sun protection. To lower your risk, use a broad-spectrum sunscreen with an SPF of 30 or higher, applying it 30 minutes before sun exposure and reapplying regularly. Wear protective clothing such as wide-brimmed hats and long-sleeved shirts, and use sunglasses that block UV rays. Avoid sun exposure between 10 a.m. and 4 p.m. and skip tanning beds in favor of sunless tanning products. Be aware of medications that increase sun sensitivity and regularly examine your skin for any changes in existing moles or the appearance of new spots. For any concerns, consult with your healthcare provider or schedule a full-body skin exam with a dermatologist. Skin cancer, while highly common, can often be effectively managed and prevented with the right approach. By understanding the various types of skin cancer and their treatments, along with adopting preventive measures such as sun protection and regular skin checks, individuals can significantly reduce their risk and catch potential issues early. Staying informed and proactive about skin health not only aids in early detection, but also enhances the effectiveness of treatments, leading to better outcomes and a healthier life.